Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and the disclaimer before starting with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I'm a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources and tools and courses, review books, and videos to assist nurses as well as nurse practitioners with being successful on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. If you need any of our resources, just let me know. We have a 99% pass rate on all of our comprehensive courses and a 100% pass rate on our one-on-one sessions and custom packages. I always like to get into the disclaimer, y'all, because just as a reminder, there's no absolutes in medicine. We treat on a patient by patient basis, right? And when I design these questions, they are based off of the guidelines that are being tested on the ANCC as well as AAMP exam currently, okay? You'll always see me doing videos of the updates. You'll always see me telling you when things are changing. Listen, I'm not the gatekeeper. I want everyone to be successful, so I'm going to provide you these tools. So when I give you these questions, know that they will vary from what we do in practice, but it's because I'm giving you what you need so that you can be successful on boards, okay? Now, for practice purposes, some videos I am teaching on the guidelines and the current things, and I will always tell you that, okay? I will say that so there's no confusion. But with all that being said, let's get into question number one, y'all. All right. Question number one states the nurse practitioner is reviewing the hepatitis B panel results. The HBsAg is positive, the anti HBs is negative. The anti-HBC IgM is positive, and the anti-HBC IgG is negative. Based on these findings, how should the nurse practitioner diagnose? Is it A, vaccinated, B, immunity, C, acute hepatitis B, or D, chronic hepatitis B? Take a moment and tell me what you have in the comments. All right, you guys, I always recommend reading the stem of the question first so that it slows you down to ensure you're answering what is truly being asked of you. You know what I mean? Even though that may seem tedious, I don't want you just reading the scenario because sometimes they'll give you this whole paragraph and they're telling you about your patient's blood sugar levels and their blood pressure, and then the question is asking you about the hepatitis B serology. And so you started to create this storyline that is unnecessary for you, okay? So take a moment and see what the question is asking, and then you can go back and read the scenario and take what you need from it, okay? So here, the stem of the question states, based on these findings, how should the nurse practitioner diagnose? All right, you guys, you know how I talk and teach. If they're asking for a diagnosis, we're going to run it back and see what the assessment shows us, right? So here, the patient is in the office. The nurse practitioner is reviewing the Hep B panel results. The surface antigen, which is the HBsAg, is positive, and the anti-HBs is negative. Y'all know I always say when we're doing hepatitis B serology, we look at these panels. Those are the first two things you should look at, right? If the surface antigen is positive, they have it. If the anti-HBs is positive, they have antibodies, either from vaccination or the antibodies from immunity from past or chronic illnesses, right? So here, the surface antigen is positive, so we know they have hepatitis B. Now, is it acute or chronic is what we're trying to figure out next, right? Because you can eliminate A and B because there's no immunity or vaccination at this point, right? So now, the core, IgM and IgG, right? Remember IgM being in this minute acute, that's the little phrase you hear, and then IgG gone for chronic. Um, so here the IgM is positive. So it's letting you know they have it right now. So this is C, acute hepatitis B, okay? C, acute hepatitis B, because IgM is positive, so they have it right now. If they would have been positive for IgG, that's chronic, so then it would have been D. But the answer choice here is C, acute hepatitis B. All right, let's get into question number two. All right, a patient presents to the office today with complaints of a band-like headache. The nurse practitioner is planning treatment options for the patient. What is the best treatment? Is it A, acetaminophen, B, ibuprofen, C, sumatriptan, or D, nothing at this time? Have the patient to follow up. Take a moment and tell me what you got. All right, so stem of the question states the nurse practitioner is planning treatment options for the patient. What is the best treatment? If we're doing treatment, we're going to run it back, see what the diagnosis is, see if the diagnosis is provided in the scenario. Figuring out what you have come up with a diagnosis. If it's not provided, you need to go back and see what the assessment findings are, right? So that you're walking through. And my best recommendation when you're doing these things is picture this scenario with your patient in front of you, right? And walk through it. So the patient comes into the office. Your patient has come into your office today and they're complaining of this band-like headache. First off, when they say band-like, you should instantly go to what type of headache? Tension, right? You're thinking tension headache, right? When they put those key identifiers, make sure that you're not missing those. So how do we treat a tension headache? NSAIDs, right? NSAIDs are that first line therapy for those tension headaches. So B, ibuprofen, will be your best answer choice here, okay? Also, and I design questions like this as well to make sure you're knowing your medicines and your drug classes. I have so many people that y'all know this stuff and you're studying it backwards and forward. And the gap, like when I'm working with people in our one-on-one sessions, the gap that you run into is that it's the application because it's that small little piece that y'all are not connecting. So band like is tension, and you treat with the NSAID, and then you get stuck because then you're like, all right, which medicine should I pick? Acetaminophen is Tylenol, right? That's not an NSAID. Sumatriptan, right? That's Imitrex. Knowing your what am I trying to say? Brand and um, generic names of your medicines also, so you're not tripped up, right? Because you can review something over and over and over, and I'm not trying to get on the soapbox. You can review something over and over and over, and you do know it, but you can't apply it because you don't have that foundation there, right? So what I mean by that is you knew band like, you knew tension, you were able to go from assessment, you were able to diagnose, but when they asked you just from a different perspective and didn't say insane, then you didn't know how to treat because the knowledge gap was then understanding your medicines and the drug classes they're in, right? So that's why it's key to really walking through each of these things. And that's why I stress so much study, assessment, diagnosis, evaluation, treatment. That's why when you do one-on-one sessions with me, I am big on these pieces because it's like, hey, I can quickly identify where your gap is. And now I'm able to fill those pieces because I see where your connection isn't. You can run it and recite these things to me, but then right here is what's getting you stuck. That's why if when they give you those unsuccessful reports and they give me the breakdown, it'll say assessment strong, diagnosis strong, planning, implementation, or treatment low. This is why. But sorry for my rant, but that's the breakdown I want you to study in this fashion when you are reviewing, okay? All right, and lastly, question number 3. A patient presents to the office today with a burn to the right side of her abdomen. Upon examination, the nurse practitioner notes a full thickness burn to the entire right lower quadrant of the abdomen. The patient denies any pain at this time. How should the nurse practitioner diagnose? Is it A, a first degree burn, B, a second degree burn, C, a third degree burn, or D, a partial burn? Take a moment and tell me what you got in the comments. All right. Stem of the question states the patient denies any pain at this time. How should the nurse practitioner diagnose? Again, diagnosis, run it back. What is the assessment? What is the subjective findings? What are the objective findings, right? So the patient presents to the office today. They're talking about this burn to the right side of their abdomen. The nurse practitioner is assessing and examining, noting a full thickness burn to the entire right lower quadrant of the abdomen. All right. So again, key description. It is a full thickness burn. Full thickness burns are third degree burns, right? Third degree. If it's full thickness, it's third degree. It also says that the patient denies any pain. Third degree burns are painless, typically painless, painless and full thickness, third degree. They talk about blisters, think second degree, okay? But here, your best answer choice is C, third degree burn. And I often hear people, we get stuck on the rule of nines because you think of the adults, the children. Sometimes in those images, and I really say look at the images, just try to visualize it. But front and back half and how things are. But I just wanted to throw this reminder out because since this is a third degree burn, when do you know to refer? If it's covering, on the face or 10% of the body, you want to refer out. This can be an emergent case, okay? And so, with that being that this is covering the entire portion of the right lower quadrant, you do want to watch that because the trunk is considered the front of the trunk, chest, trunk, area and region is 18%, back 18%, for a total of that area to be 36%. And I'm talking rule of nines. So just know 18%. So you're considering here to refer this patient out also because it's covering such a large portion of that abdomen and it's third degree. So if they told you that it was greater than 10%, if they told you, the entire chest was burned, being that is 18%, considered 18%, you want to refer out for emergency management and treatment. Okay. So I just wanted to throw in that sidebar, but I hope you guys found this helpful. As always, be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. I appreciate all of your participation. Um, and if you need any of our review material, our ebook, our paperback book, again, those links are in the bio of the channel. The ebook, once purchased, you have instant access on any of your devices. And then the paperback book and ebook are the same. It's just your preference on how you would like to have it. The book is broken down by system. It also has an interactive section. There's a video in my under like the shorts that kind of shows you, if I flip through the book so you can see and get an idea of what it's like. Amazon, you can also flip through and get a preview of the book also on there to see if that's something that you need. And then it has practice questions in the back with rationales as well. Okay. We have our self-paced review, that's system by system videos of me teaching this with mini quizzes with each system, or our one-on-one sessions where you will work along with me to assist you with either a weakness making it a success, or if you want something more longer, like a 2 week, a 4 week, 6 week, whatever your time frame is that you're trying to prepare for boards. Commonly utilize that custom packages for commonly seen with my review students who have been unsuccessful before and are looking on how to be successful. And so we work through, we structure, we gauge where you are, looking at those previous test scores and looking at the pre-test and things that I provide, and then we work through and I work alongside with you to get you to successful. But anyway, as always, you guys, make sure you meet me back here. Give us a call at 803-400-6864. If you need any of our resources or have any questions, you can also shoot a text to that number or shoot an email to the nursingstudio1@gmail.com. But happy studying. Bye, y'all.